COVID in the UK. Did private hospitals deliver value for money? It was sold to the public as a first-of-its-kind deal. First-of-a-kind deal, like extra. Private hospitals would make available 8,000 beds, staff and equipment to help the NHS cope with the pandemic. They were paid more than £2 billion. But did taxpayers get value for money? A BMJ investigation found that out of the private sector's 200 contracted hospitals, only 30 took COVID patients as inpatients. And when it came to cancer, just 7 of the 27 private hospital businesses on the contract treated NHS cancer patients needing chemotherapy or radiotherapy. The private sector also promised to care for NHS patients needing urgent care. They were permitted to treat private patients if they paid 15 to 40% of the revenue for this work back to the NHS. The BMJ found that Circle, Nuffield Health, Ramsay and Spire used 49% of their episodes of inpatient care to treat private patients rather than NHS ones, despite having their expenses paid for by taxpayers. The NHS has since refused to reveal how much private patient revenue was paid back to taxpayers, as per the terms of the contract. Meanwhile, the private sector blames the NHS for not filling private sector beds with NHS patients. It says the national contract was about offering capacity, not activity, and that the BMJ's data is not reflective of all the work carried out in private hospitals. Experts are calling for a public inquiry into the contracts. The government now wants private hospitals to help tackle NHS waiting lists. Will there be more transparency this time?